Hello friends, I am Dr. Abhijit consultant neurosurgeon. Today we are going to talk about an interesting topic, carpal tunnel syndrome. So what exactly is this carpal tunnel syndrome? A nerve by the name median nerve passes into our hands from under a band-like structure at the level of the wrist. This nerve supplies the lateral aspect of our hand. Sometimes this band gets enlarged and starts compressing the nerve, leading to symptoms, which are known as carpal tunnel syndrome. Now you might wonder why this name. This name is because the nerve is compressed at the level of the wrist or the carpal bones, and the nerve passes under the band like a car passing under a tunnel. Hence the name carpal tunnel syndrome. So what are the symptoms of this syndrome? Pain in the hands, tingling or numbness in the fingers except the little finger, difficulty in holding on to things like a pen or eating food, sometimes radiation of the pain from the wrist backwards towards the elbow. So who are at risk of developing this syndrome? Women in general are more predisposed than men. Obesity, thyroid disorders, diabetes are additional risk factors. People involved in certain professions like those who do drilling work or are on the computer for long periods of time are also predisposed. Sometimes certain anatomical variations of the nerve or the carpal bones make a person predisposed to development of carpal tunnel syndrome. How do you diagnose this syndrome? Most of the times it is clinical based on the symptoms of the patient. In order to confirm the diagnosis, a nerve conduction velocity test can be done which identifies the compression of the median nerve at the level of the wrist. An ultrasound of the wrist can also be performed which shows the thickening of the band-like structure and also thickening of the median nerve just proximal to the level of the compression. So how do you treat these patients? Patients in whom the symptoms are mild and not progressive can be treated conservatively with the help of physiotherapy. In patients in whom the symptoms are severe and progressive, a simple daycare surgery is performed in which an incision is taken on your hand at the level of the wrist. The band-like structure is identified and opened up in order to relieve the pressure of the nerve. So all in all, the identification, proper diagnosis and treatment of people with these sort of symptoms is necessary as carpal tunnel syndrome is easily treatable. Thank you.